Hello, I am Dr. Harini Sreedharan, consultant neonatologist and pediatrician at Mazumdar Shaw Medical Center, Narayana Health City. Today, I am going to be discussing the options available for women who need to join work early or the diet for early separation from the mother. Normally, we recommend breastfeeding up till 6 months of age, and it is exclusive breastfeeding. Exclusive in the sense we are advised not to give any other food or water or drinks to the baby during this period. After 6 months, we gradually introduce complementary feeds or reduce the quantity of breast milk and increase the quantity of solid or semi-solid food for the baby. There are times wherein the mother may be forced to go to work earlier, and at this point the common concern is, how do we manage the diet of our baby? Will the baby continue to gain adequate weight, and will the baby get sufficient nutrition? There are many options for this, and you can discuss these options with your doctor. Some of the common options used are, if possible, the best option would be for the mother to continue to express her breast milk during the working hours. Based on the number of breaks she can take while at work, she can get access to a good quality breast pump and continue to express her milk every 2 to 3 hours at work. This milk can be stored in an ice pack in a container and can be brought home during travel. The same milk can be kept in the fridge for quite a few days. The same milk can be rewarmed and given to the baby. Generally, expressed breast milk, which is well stored, does not get spoiled. At times, the taste may be altered. As long as the baby continues to accept it, it should not be a problem. The general question is, how much of milk would your baby need in your absence? The general estimation is that the baby may require approximately an ounce, or that is 30 ml per hour away from the mother's period of absence. So the mother can continue to express her breast milk and store it and transport it back home. The time the mother is in contact with her baby at home, she can continue to breastfeed the baby on demand. If possible for the mother to take a break during work and come home and feed the baby, that would also be an excellent option. There are times when this is not possible and expressing may not be that easy or that comfortable or that possible for the mother. So in such cases, if your baby is below 6 months, the best alternative would be to go towards formula milk. Formula milk has its own risks and disadvantages in terms of lack of immunity power in the formula and the risk of picking up infection from bottle feeding or through the process of making or manufacturing the formula at home, if there is any contamination in its mixture. But in the absence of breast milk, this is another very good alternative. So the mother can continue breastfeeding the baby whenever she's at home and give formula milk during her hours of separation. In such a situation, in the initial phases, the mother may get an engorgement and leakage of the breast, and she may require to express the breast till she feels comfortable and it is not very messy till then. The other option at some point of time is, in case your baby is approximately around 5.5 months and 6 months, instead of formula, semi-solid or solid foods can be introduced to the baby if your baby is showing any signs of readiness or is developmentally ready. Some signs of being developmentally ready are, if your baby is able to hold the head and if your baby can be seated in an upright position. Then in such cases, homemade porridges or mashed and pureed foods and fruits can be introduced and started for the baby in the absence of breast milk. Breastfeeding needs to be continued whenever the mother is at home. It is common at times when your baby is changing between formula and breast milk or breast milk and solid, there may be some changes in the stooling pattern. Your baby may have slightly more watery stools or slightly more harder stools. Usually over a period of days, this issue settles down. Unless and until your baby is struggling for passing of stools, the baby does not require any active treatment for the same. While preparing the formula, it is very important to sterilize all the bottles and all the equipments to make sure you clean your hands well so that the risk of the baby picking up any infection is minimized. It is also important, in case you are bottle feeding, to keep quite a huge number of bottles, say approximately 4 to 6 bottles, so that you don't have to use the same bottle again and again, and you get adequate time for sterilization of each bottle between the feeds. The same holds true in case of solids, and it is important to clean and sterilize all the feeding material before feeding the baby. The fruits, vegetables and other foods should be well washed. The consistency should neither be too thin, as any food which is too thin may not lead to enough growth and weight gain, as it may be deficient in calories. Neither should the food be too thick that your baby is not able to swallow. Before the mother goes to work, it is ideal if she is able to start the new schedule of feeding approximately 2 to 3 weeks before, so that she gets used to, or she is able to tackle any problems which may arise, rather than getting stressed up at her workplace whether her baby is being adequately fed or not. At sometimes the baby may refuse to accept either a bottle or other food from the mother, as the baby closely associates the mother with breastfeeding. Any other caregiver can be approached to do the same. It is very important not to feed your baby semi-solid foods or solid foods in a bottle, as it may lead to choking hazard. So a spoon and a cup can be used for the same. So in case you need to join work early, kindly discuss all the options available with your doctor. Thank you.